Well, hi everyone, this is Dr. Schroeder with this week's video introduction to week number 7 in our course in healthcare research. And once again, another very nice week of discussion. Of course, this week we shifted focus from the quantitative studies that we had been studying earlier to qualitative studies. And we talked or started this discussion with this week's discussion on sampling and how sampling is different in qualitative studies from quantitative. The most stark difference that most of you picked up on and pointed out in your discussion of the readings was that qualitative studies are generally much smaller than quantitative. I posted a few responses about that. And the reason for that is because in quantitative studies, everything's about data. You know, the more data that you get, the better. And there's no such thing really as data saturation. I mean, unless you have 100% of the available data, there's no such thing as data saturation. You're always just going to have a portion of data. There's always going to be some data that's left out of the mix. And so that's why the more subjects that you have, the more data points that you have, the more likely it is that the results that you find are going to be representative of a larger population of the whole. Um, and that works very well with quantitative. However, in qualitative, it's a little bit different because we're talking about this thing called data saturation, and some of you were struggling a little bit or trying to wrap your head around what does that exactly mean. And very simply, in a nutshell, it's when the researcher is looking at responses from subjects, and when you're talking to subjects about a specific topic, whatever it is that you're examining, when you stop getting new information, and in other words, when the respondents keep coming back with the same information over and over again, and there's no new themes, when you go to people and say, is there anything else that you'd like to discuss about your experience? And they're kind of like, no, that's pretty much it. That's really at the point at which you reach data saturation. Data saturation comes and isn't necessarily improved with adding new subjects to the mix. If you have 15 or 20 people talking about an event and everybody has talked about pretty much the same thing over and over, chances are, if you're going to go get 20 or 30 or 50 or 100 more people, you're going to be saying the same things over and over again. You're not really going to be getting any more data. Again, it's not the quantitative data that you're trying to achieve. It's the quality. What are the themes that you have? And usually in most studies, you can do this with as few as 5 to 10 subjects. It really depends on the study itself, but it's not uncommon to have a qualitative study that has as few as 5 or even fewer subjects. It's not unheard of, not uncommon. When you have a study that is one person, that is what is known as a case study. A case study is a form of a qualitative study where you take one person's experience. Now, a case study is where you take one person's experience and looking at very intensely, and that may or may not be necessarily representative of a bigger whole. You want more than just one person to really try to get an idea uh, for what an experience would be like. But again, it depends on how individual that particular experience is. If you're trying to examine a topic where there is just a few people that have been exposed to it, people, for example, that have been picked up and thrown by a tornado and lived through it, or have been struck by lightning and have lived through the experience, and what is it like, and how did it change your life, and all those sort of things. You're not going to find a lot of people that have been through that experience, and so you may only have one or two people. So it really depends on that experience and the type of experience that you're looking at is going to really point the direction, and how large does your sample really need to be. Transferability is something else that we talked about a little bit and was a focus of this week. This transferability, can you transfer the feedback from the subjects in these particular studies to a larger population? And again, with the studies that we were looking at this week, and the study that we were looking at this week, it's kind of hard to draw inferences beyond the specific culture that this particular study was done in. This study was, of course, the end-of-life experiences with patients with ESRD and the decisions that they make and their attitudes towards their treatment. Because it is a very specific population, it would be difficult to say that their results are transferable or they can be generalized to a larger Western population. They're meant specifically for that particular culture. And that's something that is also important in qualitative studies. Qualitative studies typically will focus on cultural differences and on cultural attitudes about healthcare or about whatever the study subject is. So anyway, so that was a very good discussion. And so into week 7, we go into well, first I'll say that the assignment you have due this week is your qualitative critique. You've all received feedback on your quantitative critique. And that feedback can kind of guide you into, you'll see how you need to maybe, or how you should adjust some of your assessment or some of your responses on the qualitative critique. Works very much the same way. You're going to have the individual criterion questions and be expected to address those. And if you were really happy with your score and you like the feedback that I gave on your first paper, chances are you know exactly what you need to do for this paper. However, if your score was a little bit less than you anticipated or less than you would have liked, look at my feedback. If I was asking you for more information or saying that you really didn't cover a specific criterion, specifically, go back to the book, read about it a little bit more. If you find that you're just restating the criterion itself or answering it almost like as a yes/no question, that means that there needs be a little bit more in-depth discussion. So let my feedback on that guide you. Coming up in week 8 is going to be your final your final examination. It's going to be just like your first examination was. It is more cumulative, although there is some information that is covered from your first exam will be on this one as well. That will open on Sunday night and it will close on Thursday. Be aware of that. It does close early on Thursday because class is technically over on Friday and I have to have grades calculated by Friday evening. So that's why that closes so early. All the grades have to be done and everything has to basically be finished up by that Friday. So discussions and your final exam are all going to be due on Friday. Everything's done on Friday and then the final grading will be completed, will be done, everything will be due, I should clarify, Thursday evening. And your discussion questions will be finished by Thursday evening. With everything finished by Friday as far as grading and everything. So I look forward to once again participating in class along with you and for answering any questions that you have. If you have anything that you would like me to clarify or anything that seems like it might be a little bit questionable, go ahead and let me know. I'd be more than happy to clarify that. Have a great week. By the way, those of you that are not Pittsburgh Steelers, but Penguins fan, for those of you NHL fans, congratulations. For those of you that aren't, well, I'm kind of sort of fall into that camp myself, but I do bow my head to the Penguins. They are quite the powerhouse this last couple of years, so my hat's off to them. And for the Nashville fans, I'm sorry. I understand about that too. So we look forward to seeing you in class and seeing you in discussion forums.